Lower GI bleeding is defined as abnormality or abnormal hemorrhage into the lumen of the bowel from the source distal to the ligament of Treitz. And 90% of those patients presenting with lower GI bleeding stop simultaneously and rarely present with hemorrhagic shock. So most patients presenting with lower GI bleeding, they are hemodynamically stable when they come to the emergency room. And the mortality rate is lower than upper GI bleeding. It's usually less than 3 or 4%. Lower GI bleeding in those patient has to be resuscitated, and after they have been stabilized, should undergo a colonoscopic examination. 60% of those patients will require therapeutic intervention, and 40% of they will have endoscopic hemostasis, 1% they will have angiographic embolization, and 25% will go for surgery. With regard to the etiology, I have listed here the etiologies with the graph and also written on the left side. The most common cause of lower GI bleeding in general is diverticulosis. However, anorectal disorder is quite common. Either rectal varices, hemorrhoids, anal fissure, rectal prolapse, or for example, solitary rectal ulcer syndrome. The colonic causes included here, such as colonic cancer, inflammatory bowel disease, diverticulosis, which is one of the most common etiologies for lower GI bleeding, polyps, infectious diarrhea, angiodysplasia, and ischemic colitis. Small bowel etiology, such as small bowel angiodysplasia, ischemia, ulcers in the small bowel or tumors, and Meckel diverticulum, especially in young adult males, it has to be considered. And upper GI source, especially if it's massive upper GI source, it represents between 5 to 10% of all the etiologies of lower GI bleeding. I listed for you here the causes or the etiology for upper GI bleeding. As you can see, the most common cause is diverticulosis, 30%, colorectal cancer and polyps, around 15%, anorectal disorders such as fissures, hemorrhoids, 10%, ischemic colitis, another 10%, angiodysplasia, another 10%, infectious colitis, 10%, radiation proctitis, 5%, inflammatory bowel disease, especially ulcerative colitis, 5%, and other etiologies listed here.